Welcome to the second part of this three-part series on research synthesis for evidence-based health policy. And we're excited for today's session because it's a bit more practice-oriented. So we're actually going to spend some time in breakout rooms working through the process of evidence synthesis, practicing, what does it mean to do screening? How do we come to agreement around what to screen and how to screen? And all that good stuff, which will then set us up for our final session where we will do even more practice and kind of application of this work. So welcome to part 2. Amy and Laura, do you want to add anything to that?
Just that we're librarians at the Tulane University Mattis Library of the Health Sciences. And we do work with a lot of systematic review and evidence synthesis teams.
Yes, thanks, Amy. Laura, do you want to introduce yourself?
Hey, hi, I'm Laura Wright. I'm the coordinator for research services at the Mattis Library, and today is actually my 10-year anniversary of being at Tulane. So, yes.
Congratulations. And I've already introduced myself, but we are your facilitators for today. And so we will be going in and out of breakout rooms, conversations, and all that kind of good stuff. Should we go to the next slide? Great. So as I mentioned, this is the second part of the 3-part series. The last one is next month. And today it's roughly kind of a 75-minute workshop. We're going to do a little bit of recap and review, spend some good time in some active learning, doing advanced searching, doing some screening, and then spending some time with questions and application to the real world. Amy, thanks for dropping in the link, the Padlet. So everyone, this is a tool that we're using to capture questions that folks have during this presentation. If I can share my screen just really quickly, just so folks who might not have been there at the last workshop, it just looks a little something like this. And if you just click on the add button right here, you can draft a question to us and it'll collect it here and we can spend time responding to in here, or we will be monitoring this throughout today for us to go through any questions you have. So I'll stop sharing my screen. Thanks, Clara. Yes, the slides were shared from the last workshop in a follow-up email through Eventbrite. So those, and if not, you'll get them through this one. So today's learning objectives are to learn about advanced database searching. So how do we ensure that we are getting the literature and science that we want through our evidence-based synthesis? Creating a systematic search, we're going to do that in PubMed as an example in terms of how to do that searching. And then we're going to go through the process of screening and doing a hands-on exercise to go through that process, really to determine how, what are the best practices in doing our article screenings? How do we ensure that multiple screeners are on the same page in terms of what they're screening, to make sure that ultimately we get to the data and the science that we want to be included, and answering the related policy or research question. Cool. Laura and Amy, do you want to recap here?
Yes, I can. So we will just be doing a quick set of breakout rooms to review workshop. Oh, sorry. That's in a minute. But this is just a quick review of what we talked about in workshop 1. So we just talked about evidence synthesis generally, and about how that ties into writing for policy. So if you were not at that workshop, we recommend reading the slides, watching the recording. But for the purposes of this workshop series, we'll be concentrating on rapid reviews, which follows the same steps as other evidence syntheses. And we recommend you search 2 or more databases. 2 reviewers are preferred for study selection, and 1 researcher may perform data extraction and risk of bias assessment. You'll be learning more about this information as we go on. So if you feel like you're not sure what we're talking about just yet, don't worry, we will be guiding you through all of this. Next slide. And this is just a quick overview of the 8 steps that we just touched on each of them throughout the first workshop and just gave a overview. But for the purposes of today's workshop, we will be concentrating on steps 2 through 4 for the most part, and the next workshop will really be hitting the ground running on the other steps. No worries if you weren't at the first workshop, you won't be totally lost, and you will have all of those resources to review as well. Now is when we're going to be doing the breakout rooms. We'll be reviewing the homework, which I've also added in the chat in case you don't have that immediately accessible. But just if you did the homework, or even if you didn't do all of the homework, just talk about your research interests and share your research question, where you found background information, which keywords you searched, any progress you made on a protocol, and which databases that are available to you that you found that you could use on these types of projects. And you'll have about 10 minutes to share with your group, and you can look at the box link for that workshop as well, or for that homework as well. Thanks, everybody. I hope that was at least enlightening to kind of get an idea of what other people's research interests are and learn a little bit about what they've learned so far about their topics of interest and the resources that they found that they have access to. So I'm going to turn it over to Laura to talk about searching.
And Laura, I'm going to just jump in real quick because our group had a cool conversation. So I just maybe want to share. The homework assignment that we provided, that Eclipse mnemonic is something that we think about and use when we're developing our policies research question. It's not to say we're like running through each part of Eclipse and outlining it, but rather and Delania, I hope I can use your example. Delania does some research and work in diabetes self-management with folks living with disabilities. And so we took that mnemonic and then thought about what is a question we would ask that then would lead us to the search terms we need to conduct the search research synthesis. And so we came up with something along the lines of what interventions shape the capacity of folks living with cognitive disabilities to self-manage their diabetes. And so in that example, when we start our searching, we're going to do things like searching around the terms intervention. We're probably going to maybe include things like behaviors. We're going to limit it or include search terms around folks living with disabilities and cognitive disabilities specifically. And then, you know, our health state is diabetes. So we're going to limit all of our literature to diabetes. And so these are, we just want to provide that as an example of how we go from that question. And now we go into searching, which Laura will get into in more detail. But I just want to provide that as an example to how we apply this in practice.
Yes, that's great. Exactly, the question and the protocol should guide the next step that Laura will be describing, which is searching.
All right, thanks, y'all. Okay, well, so let's get started with today's learning by talking about searching the literature for your evidence synthesis. Here are 3 main tips to remember when searching the literature. Document your search strategy. This helps you stay organized and helps your work to be reproducible. I keep an Excel sheet with all of the information about my searches, so I can quickly look back and see what I did the last few times I've searched. This is helpful if you're working on multiple projects, or if you need to step away from your project for a certain amount of time, or if you need to hand your project off to someone else. It's also helpful if you think you're going to want to update your review on your topic in the future and see what has changed in the intervening time period. Your goal is to identify all of the studies that meet your eligibility criteria, so that you're sure to be providing a good analysis on the topic. That's number 2. And third, remember to use more than one resource to find your information. Using only one database will introduce bias into your analysis, so look at different sources of information to ensure a more thorough analysis. Now, when you have a question you want to look into on a database like Google, you can just type that whole thing in and get results. However, most research databases require you to break your question down into smaller topics to effectively find the information you're looking for. We're going to use the following question for this workshop today. What social determinants of health affect rates of maternal mortality in the Black community in the United States? Now, what are the main topics we are looking at with this question? We actually have 4. One is the social determinants of health. The second is maternal mortality. The third is the Black community. And the fourth is the United States. Now that we have our topics, we can go look in these research databases. Research databases usually have what is called a controlled vocabulary, or a thesaurus that tells you what words the database assigns to various concepts. PubMed is one of the few freely available research databases related to health, so we will start with PubMed. PubMed's controlled vocabulary is called MESH, and it stands for medical subject headings. You don't have to remember that. But let's go into that database and see what the MESH term is for the Black community in PubMed. Okay, so we're here in PubMed. This is the main database we're looking at, but we want to come down here to where it says Explore, and we want to go to the MESH database. So this is a separate database that works with PubMed. It's telling you exactly what those terms are. So I'm going to go ahead and in the MESH database, just type in Black community. And we'll have no terms. So what I'm going to do is I'm going to break this down a little bit more, and I'm just going to see if we're looking for Black individuals, what that term is. So we have Black people and we have Black or African American. What we have here is a description of what this term, it means explicitly to this database. And we have a different definition down here. So what we can do is take a look at Black people, and we can look at Black people or African Americans. So Black people is described as people having origins in any of the Black racial groups of Africa. Note that the category Black or African American is available for the United States population groups. So that's good for us to take a look at because we are very specifically focusing on the United States and maternal mortality there. All right, so this would be our term here. Now that we have this term, I'm just going to add it to my search builder. Okay, and that's a quick run through of how to use this. I'll go ahead and search in PubMed, and so we'll have one of our topics for this search. Okay, going back. So once you've finished your first search, you can use the additional databases and see what terms they use in their particular database. So I started with PubMed. If you are using something like CINAHL, which is one that's freely available in many public libraries, you can take a look at their controlled vocabulary and see what terminology they use. So you see what's very specific to that database. Okay, so once you found your database specific terms, it's time to build out your search a bit more using synonyms. So the reason you want to use synonyms is in case the databases make mistakes. After all, they are designed by humans, and to make sure you aren't missing anything of importance. There are a few ways to find synonyms that I personally use. The first way is to look at any suggestions that the database gives you. You often find those in the controlled vocabularies. Another thing I do is a Google search and see what language people naturally use to discuss a topic. And the third thing is to think about field-specific jargon. Every field has jargon, so what is the particular jargon for your topic? Okay, so let's think about some synonyms. Go ahead and put in the chat some synonyms for maternal mortality. Okay, awesome. So we've got a few, and they're different from the ones that I've listed here, childbirth deaths. So we have terms like maternal death, adverse birth outcomes, pregnancy-related deaths. So these are all good synonyms to think about when you're talking about maternal mortality, and sometimes perinatal mortality. Sometimes it's a good idea to just talk to other people and they'll give you ideas that you wouldn't have thought of. Awesome. Thanks for engaging, everyone. And lastly, so we've talked about breaking our question down into topics. So let's briefly talk about putting them back together. What we have here are called Boolean operators. They're the ands, the ors, and the nots. So these diagrams give you a good image of what happens when you use and, or not in a search. So if you want to find information about your topics together, you would use and. So maternal mortality and Black or African Americans. If you want to find information about any of your topics and not necessarily together, you would use or. So if you wanted to do maternal mortality or information about the Black community, you would do or. You would get stuff about everything. So it would not be limited to just the Black and African American community or to maternal mortality. You'd find stuff about both of those topics and everything related to them. If you want to find information about one topic, but not about another topic, then you would use a not. We typically advise against using not, but feel free to play around with it in different databases. So for our question, what social determinants of health affect maternal mortality in the Black community in the United States? Which Boolean operator would we use? Okay, so this is kind of a trick question. If you're putting the topics together, you would use and because you want to find information about social determinants of health, maternal mortality, the Black and African American community, and the United States. If you were including those synonyms, you would want to or them with all of the similar terms. So if we were thinking about maternal mortality, we would want maternal mortality or perinatal mortality or childbirth deaths. And this actually does make a lot more sense when you put it into practice. And one thing I tell people that tends to scare them a little bit, but then gets a little bit better is that it's like math. You're making an equation while you're searching in the database. Okay, so we have our first active learning activity for you today, and it's going to be a search activity. So I'm going to have Amy drop the link to the activity in the chat so everyone can have it before you go to your breakout rooms. But what you're going to do is you're going to practice searching for information about the research question in PubMed. And to reach PubMed, I'm just going to go ahead and put it here in the chat. You can just do pubmed.gov. And we're going to be looking at this question that we were looking at earlier. So what social determinants of health affect rates of maternal mortality in the Black community in the United States? So we're going to give you about 10 more minutes in breakout rooms of 3 to 4 people so you can start searching for these different terms. So remember to use your mesh terms or your controlled vocabulary and to also think of synonyms.
And Laura, Amy, I maybe want to just spend a quick second just showing folks kind of an example of what this might actually look like in practice. And so I just want to share, this is a search that we put together on HIV risk among gay, bisexual, MSM globally. And so while we showed you in the practice, like how you put them together in one stringing search, what we are actually doing behind the scenes is running each concept's queries and different synonyms separately. So if you look at the concept of gay or bisexual or other men who have sex with men, there's almost 52,000 studies. We wanted to only focus on systematic or scoping review type of studies, which there's almost 390. But then what happens is as we start putting these terms together, so 1 and 2 and 3, so this was gay, bisexual, systematic, and then HIV infections, what you start to see is the numbers drop. So as our Boolean loops are operating, they are creating kind of synthesizing that literature and dropping down the numbers because it's finding just those terms.
And I will say, this always kind of hits me when someone shares a search that I wasn't expecting to see all of a sudden, that it looks pretty intimidating until you start doing it more. It actually starts making a lot of sense very quickly. It's kind of like computer coding. It makes absolutely no sense until you've looked at 1 line or 2 lines, and then you're like, oh, this isn't nearly as hard as they make it out to be. So just for a little reassurance for everyone, it always hits me that I'm like, oh, I understand this. Most people don't until they do. We did want to give everyone at least a chance to share. We're going to do it for about 1 minute just due to time, but is there any group that would like to share what they were talking about in their breakout room? All right, perfect. Well, I'm going to go ahead and hand it back to Amy so we can start talking about screening articles that you find once you've done your search.
Laura, will you be sharing the slides?
Yes, I think they might have disappeared when I was in that room. Hold on one second.
I think they just disappeared when Christopher shared this search, so no worries.
They're back now.
Thank you very much. Oh, it's still on your presenter view again.
All righty.
Sorry.
All around on me.
All right, so now you all can read it a little bit better. So screening. So once you have all of your articles, that is the data collection. That's a very important part of the research. That's all the data you're collecting. So you want to collect as many relevant articles as possible. But of course, in that, because databases are not perfect, there will be some articles that are not relevant. And that is where screening comes in. So the purpose of article screening is obviously to remove studies that are clearly not related to your topic. And that is where the inclusion-exclusion criteria comes into play, which should be already outlined before you even do your search in your protocol. So first, you screen the titles and abstracts of each citation that comes in. And depending on how you're doing it, there will be a lot of duplicate articles that because you're searching more than one database, so there will be most likely a little bit of overlap. And depending on the software you use, you can either deduplicate using a citation manager or other resource like that, or sometimes screening software has a deduplication feature, which I will we won't be endorsing any one particular screening software, but we'll be sharing a few options. But so first you read the titles and abstracts, and it'll be quickly obvious if it's not related to your topic, and you can use that inclusion-exclusion criteria. So you don't have to read the whole article at first, just those titles and abstracts. And if you decide to use evidence synthesis screening software, that can help the whole group kind of lighten the load for each person. So it's not just one person reading every single title and abstract. Most of the time it recommends 2 reviewers for that screening, but for a rapid review, depending on the number of citations, sometimes one reviewer will do the title and abstract screening. But the recommendation is if you're not sure or if there's some sort of disagreement about what should move on, making sure there is a subject area expert on the team who has a familiarity with the topic generally. And so full text screening, obviously, it's everything that you said yes to in the title abstract screening. And that is when you pull the full text of the articles, and using that same inclusion exclusion criteria, you really go through each article with a fine-tooth comb. 2 reviewers are recommended, and it sounds overwhelming at first when you look at the number of titles and abstracts to screen, but it is, I promise, will be a lot of articles in the title and abstract screening that you roll out for one reason or another. So full text screening is usually not as overwhelming of a process. And if you aren't affiliated with the library, you will most likely be able to still get many of the articles because a lot of biomedical articles are available open access. And if whatever library you're using doesn't have access to the articles, you could use interlibrary loan to get those articles, just a recommendation. Next slide. And I mentioned the inclusion-exclusion criteria, and we mentioned it a little bit in the first workshop, but I just wanted to show an example of what it might look like within the context of a protocol or paper. So these must be decided before the start of the review, and just kind of keep it on hand when you're screening articles. So Exclusion criteria is everything that would make a study ineligible, and inclusion is everything a study must have, which makes sense, right? So if you consider the type of studies, for example, if you're interested in randomized controlled trials, you might not want editorials, for example, in there. The type of participants, are you interested in one specific population? Adults versus children, even as general as that, might be a particular concern. The type of intervention. So a lot of times it might be, you know, is it a medication? Is it a public health policy? Is it a legal matter? So considering that sort of thing, and outcome measures, that could include a lot of different things, such as quality of life questionnaires, morbidity, mortality, a few other things. So just considering, I've just provided a list of things to consider when creating that inclusion exclusion criteria that you might not think of right at first. Next slide. So screening software tools can really help in the process, and I put some links that will be shared with the slides that you can kind of take a look at if you're ever working on an evidence synthesis project. If you're affiliated with the university, there might be a paid service that the university or the library subscribes to, but there are some freely available options out there. Rayan is one of the free options, and basically you import all of the citations, and it makes it easier to keep track of the screening process. Some people use Excel or Google Sheets, and especially if it's not, you know, if it's a smaller number of articles you're dealing with, that could be a great option. And I included a couple of other links. One is called Abstracker. It's been developed by Brown University, and it's open source, and it's in beta. It's a beta testing right now. And so there's another one called Kadima, and I'm less familiar with it, but I see that it is also recommended. And there's also some paid services depending on your budget, your department's budget, that might be an option. And the systematic review toolbox that is linked here, you can go on there and toggle to search for software, and you can look at different softwares that include different steps of the evidence synthesis process. So the ones I've outlined here are mostly relating to screening, but there's other software that can help with other systematic review or evidence synthesis or rapid review projects. So if we go to the next slide, we will be doing some active learning so you can see what we mean when we're talking about screening and kind of how it might be in real life. We have, I don't have the link right here because I'm looking at the slides, but if somebody could get the link and put that in the chat, if not, I can add it in just a moment. We have an article screening activity, which is based on that research question from the search activity. And we've outlined inclusion exclusion criteria on this activity, and there's a set of articles and abstracts to practice this title abstract screening process. So if your group wants to go through it together, it's not a large number of articles, and you can say yes, no, and discuss which articles made it to the full text screening phase. You can do it together, you can split it up and come back together and review, and we'll be doing 10 minutes, and I think it'll be a great learning experience.
And don't worry about getting through all of them.
I hope everyone's back, but I just wanted to kind of touch on the screening activity again. Part of why we wanted to do this is...
Amy, they're not all back
Oh,
yet.
sorry. Yeah.
No worries.
No worries. I can't see the timer anymore. Okay, great. I almost started talking too soon. I just wanted to say that part of why we wanted to do this article screening activity is to make the process of evidence synthesis a little bit less scary. I think sometimes people see a number of articles, whether it's a few hundred or a few thousand, and they go, I can't possibly look at all of this. But with a team and reading through those titles and abstracts, just once you just start doing it, it goes quickly. So I'm always like, just do it, just screen it, it'll be fine. So and I think by looking at a manageable set, you can see how fast it can go. So I'm sure at least the group that I was in, they had already gotten through all 20 articles and figured out halfway through that breakout room. So that was really great to see. And we can move on to the next slide. If anybody wants to share in the chat how they felt about the activity, that would be great. And we can talk about it at the end.
Yeah, or also you can use the Padlet too, which I'll redrop in the chat for any questions that you're all holding. Thanks everyone. We wanted to kind of also share some, another side to this, which, it feels really research intensive or heavy sometimes, but really what I want to focus on is that this actually has a lot of application in public health practice. And so one of the couple things I want to focus on is when you're putting together your searching and screening criteria, you really can think about what is a policy relevant question. So you might want to look at, things like this policy that's been implemented in one place versus another policy, and screening the literature to see and study how those policies have been implemented and the impacts of said policies. Another big thing that I would say is when you're drafting your protocols and projects for the evidence synthesis is really thinking about what is quote unquote a way to answer the best bang for the buck. This is something that policymakers are always looking for. How do I ensure that what I am about to fund or the program we're about to create or the practice we're about to implement is the one that we should be doing, and why are we doing it? So that's including both things like the effectiveness, how effective or impactful is this policy intervention program service, and also then thinking about what is the cost of this. And so meta-analyses and cost-effectiveness analyses go a really long way when you're doing this work. And a meta-analysis is really something that just like brings together all that literature and really determines like what is the average or overall effect of these things that we're studying in the literature. So, if we're thinking about intervention for self-management and diabetes, a meta-analysis would go through the various interventions related to the similar study designs and be like, okay, the overall effect of this intervention on self-management of diabetes is, and then some number. I mean, policymakers, practitioners really like to see that. The economic argument is super, super important here. Back to Amy's point, thinking about, this being a little daunting. I teach a class on this, and I had students in groups of 4 to 5, and they, over a 8-week course period, were able to screen and go through all the steps that we literally walk through today, all the way to the end in an 8-week process, and come together with a policy memo that synthesized all the evidence on various topics. And so it is super, super feasible if we chunk it out in these 4 to 5 ways. And then thinking about that one example I was just giving, they were looking at marijuana or cannabis legalization in Oklahoma. And then they brought in the economic or cost literature into theirs to look at, sure, you're going to have revenue from cannabis legalization, and yet there's all these costs to the healthcare system because of increased issues of psychoses, lung issues, so on and so forth. For a policy, also kind of practitioner space, you're not going to present everything you learned in your evidence synthesis. You're really going to keep it focused on that policy relevant material and information. And ultimately, it needs to be actionable. And so policymakers are really looking to translate this science into actual policy and practice. And I just want to offer an example here. So I've been working with the CDC in their HIV kind of testing branch over the last few years. And they came to us and were like, there's this strategy called social network strategy, which is working with networks of individuals and kind of having a recruiter network their whole network and bring them in for HIV testing, particularly among priority populations. And what the CDC tasked us with, they were like, hey, how come no one's using this strategy? And what we ended up doing was a whole synthesis of the social network strategy, the research literature, focusing on the implementation side of things. So what were the implementation related factors of social network strategy that makes it a useful strategy and actually can increase HIV case detection? And that was kind of our policy question of the literature. So then we did a whole evidence synthesis. We were looking at this thing called social network strategy, HIV, priority populations, and we were focused really on the process. So what are the steps in a social network strategy that one must practice and put into practice for it to be successful? And that work, the CDC took it all, have updated all their SNS materials. They're now doing new training programs with all these SNS materials. And so I just wanted to offer that as like a very practical applied project that we worked on by using the science of evidence synthesis. Are there any questions on this piece? Great, I know we're coming up on time, so we'll go to the next slide, please, Laura. I just want to offer some tips for staying organized. And this, I've learned these over numerous reviews that we've been doing now. And so just a few tips that I think have been really useful to us and our team. We've already mentioned this before, but keeping track of your search queries and results and the logic. And we submit that with every publication we submit. We also kind of let that hang together with the materials we develop. This lovely little flow diagram is called the Prisma flow diagram, which really just goes through the flow from the studies I identified all the way down to the studies we are including. The software that we've mentioned before, a lot of them will give you this little pretty visualization, and it helps you monitor and track as you go from identification down to screening, down to eligibility, down to actual full inclusion. I have loved these screening tools because it has made this process way easier to manage. Another piece is managing your citations as well. So we use citation managers. This is super, super helpful. And another kind of pieces, it's also a useful way to find the full text PDFs of your articles is by using a citation manager. We can offer resources on that. And then the last piece is really having an extraction template developed as your team goes through the data and actually starts to then pull out the information and results that you want from it. We're going to practice that more in the next workshop, but we will give you some tools there. What I typically do is just develop an Excel file that kind of has out every single study as its own row. And then we're, all the important pieces that we're pulling out, study population, outcome, so on and so forth. And that is it for tips on staying organized.
We do have some homework to kind of review some of the stuff we went over in more detail and to prepare you for the next session. So we have a couple of videos we're recommending. One is a tutorial video for Rayon, which is one of the freely available screening tools. And it's a YouTube video, and you'll get these slides, and this link will be included. There's also a data extraction video, which we will be going into more detail at the next workshop, using a program from of course, I am forgetting exactly where, but but it's called SRDR, and they have a freely available data extraction tool. So you can just kind of see how that looks before we talk about it at the next workshop. We included a library guide page from George Washington University that just kind of generally talks about data extraction and what that is. And as a bonus, if you are interested and you're not familiar with citation managers, I've linked to a Zotero citation management library guide, which I only picked Zotero because it's open source. Anyone can use that. But there's other there's other free citation managers. We don't endorse any particular one. And to do is to run the searches for your topic of interest, screen some articles and find the full text of those articles, so that you can be prepared to do data extraction in the future. And we will go on to, I'll share the Padlet screen so that we can kind of do a little bit of Q&A for a couple of minutes. Let me share my screen. So you can feel free to ask questions in the chat or in the Padlet. I hope everybody can see my screen. And this is the same Padlet for all of the workshops. So some of these we covered in the last workshop. So if I'm missing something, someone says how to know whether our search strategy is right. And I think that's a great question. The main trick, which someone answered, is to do it systematically and make it replicable. And replicable means somebody could copy and paste your search strategy, and the same articles would come up, plus maybe some newer ones. So if you look at other protocols or other evidence synthesis studies, best practices is that they would include a search as part of their supplementary data. So if they're following best practices and you know, hoping for replicability, you will be able to see examples of other searches, so you can kind of get an idea of what other searches look like. Sometimes you will think a synonym is, I've had the experience where I think a synonym is a great synonym, but it's bringing, you know, something about that's just totally unrelated because it's some kind of jargon term for another topic, totally unrelated. So you can have fun with it, kind of play around with the terms. I don't know if Laura has any other tips.
I would say the same thing. I was just thinking a good example of a synonym that is jargon is trust. So when you're thinking about like trust in healthcare, there's also the NIH, or not the NIH, the NHS trust in the UK. So just keep an eye out for things that just don't make sense for your search.
Yeah, and then just to add here, I think this is where, you know, back to earlier parts of today when we're showing you the mesh term databases of PubMed, the other databases have similar things too, right? And it's going to give you these definitions. So if you put in those words and you're like, oh, that's not at all what I meant, right? These are the useful ways for you to think about whether your search strategy is correct. Looking at those mesh terms, the combination of these terms, like, is it really going to get you to the literature that you are specifically wanting to find related to your research question and protocol and policy question?
It is time, but I do see some interesting questions. I don't know if we want to cover them. I know people are can fill out the survey and everything, but someone asked what strategies are there for finding a well-represented pool of literature that's not just white and Western, dealing with languages and translations. If your team has experience with other languages than English, that expands the types of things you can search. You know, as a person in the United States at my university, we have mostly English databases with mostly English articles, although some other languages will come up sometimes. But if your team has foreign language experience, there are other resources out there for that. You know, it really depends on the knowledge of your team and the language experience. But there are some databases that have more of an international focus than you know, PubMed, for example, which is very United States centric. There are quite a few databases out there, and I would recommend just kind of looking at all of the health or sociology, or depending on your topic, all of the different databases that are available to you, and kind of getting as wide of a number as you possibly can.
Thanks. I'm going to just drop in the chat the form for the survey. Again, we really appreciate the feedback. We really take it seriously. We think about how to integrate that feedback into what we do. So please take the time to provide us with that feedback. And we look forward to welcoming you for the final session in August. So thanks for coming, everyone. It was a pleasure having you today.